I'd like to thank Dr. Jay Shannon and the entire team for moving this project along, and of course for the good work they do day in and day out. And I'll let Dr. Shannon introduce the team that is with us. Please welcome Jay Shannon.
Good morning, everyone, and welcome. This is an important milestone. It's thrilling to be here in this beautiful, bright facility today. And it's a milestone in our continuing journey as a healthcare system to be a modern, pleasing, family-oriented healthcare system that takes good care not only of our patients, but also of our staff by giving them excellent facilities to use. I want to welcome and thank President Preckwinkle, the Cook County Board of Commissioners, and our Health System Board for their steadfast support that led to this new facility, and frankly to a journey that we're on to update and make improvements in all of our ambulatory facilities. In this regard, I want to particularly thank and introduce some members of our leadership team. Deborah Carey, who's our Deputy CEO for Operations. Liliana Mora, who's our Chief Operating Officer for Ambulatory Services. Nancy Rivera, who's our Regional Director. And then our local team here, led by Dr. Yolanda Escalona. Like my old intern, Yolanda, and Victor Medina. And really the whole team. Now they're all kind of hiding in the back here, but the whole team on the staff here. The team is thrilled. I have to just tell you quickly that we were running around and doing a little bit of a tour, and I saw a couple of our primary care providers working back in the office, and I said, well, you guys must be really thrilled about this new place. And they said, well, really the people who are thrilled about it are the patients that we're serving, that are seeing this beautiful new facility. Most importantly, I want to thank members who are here today from the Arlington Heights Center Advisory Board. Their time and their thoughtful feedback is so important to ensuring that the services that we provide here are excellent and relevant to the community's needs. With us here today are Violetta Adello Solano. Violetta, are you here? All right. She's from the Northwest Community Hospital, where she's a community health worker. We also have Evelyn Rivera Swint. Is Evelyn here? Okay, thank you, Evelyn. She's our program outreach manager for CETA. Louise Montgomery from the Hunger Coalition. Terrific. And to that point, I want to again point out President Preckwinkle's leadership for many years in the Cook County hunger improvements that we're trying to do in conjunction with the Greater Chicago Food Depository. And also Miguel Villagomez. Where is Miguel? Who's here with us today. All right, and we're going to be hearing from Mr. Villagomez in a bit. By the way, I think Kathy Pavkov just stepped in, who's our nursing leader for ambulatory, so I want to thank Kathy for being here. So as the President said, our health system has a proud history of serving everyone in the county, regardless of race, income, insurance, or immigration status, and importantly, their ability to pay. However, to protect and continue that mission, we've got to be able to attract and retain top-tier medical professionals. And frankly, we have to compete for those medical professionals with other organizations. Having clean, bright facilities like this with excellent new equipment and an integrated electronic health record is one of the ways that we do that. Now in October, we celebrated the opening of a new professional building on the Stroger campus at Damon and Polk. And that health center provides similarly modern, clean space both for the patients that we serve and for the staff. Today we're thrilled to have a ribbon cutting for this new facility, which is the first of our community-based health centers to be refreshed. When we opened the professional building in October, it was the first new construction for the health system in more than 20 years. This is going to be the flagship and the model for our community-based health centers going forward. Not that we're going to replicate the footprint, but we're going to try to replicate the wraparound services that are going to make us so vital to the communities that we serve. This is another manifestation of our continuing pivot away from reactive, hospital-based acute care and toward what we're really trying to do, which is the right care at the right time in the right place. And the right place is usually in a person's community. This center does that. It has a wide range of services, including prenatal care, pediatric care, primary care, mammography services, dental services, behavioral health services, and WIC, the Food Assistance Program for Women and Children. By providing these services, we're able to help contribute to what Mayor Hayes alluded to, a healthy and vibrant Arlington Heights and community. This health center is another step of bringing that kind of care to our patients. We will, later this year, be opening new centers in North Riverside for people in the west suburban part. Yes, Nancy's thrilled about that. And she was telling me earlier she learned a few lessons from this one that she'll be able to apply in North Riverside. And also in the Southland, in Blue Island at 127th and Western. These upgrades aren't just about new facilities and broad services. They're also about cultural competence. So I'm particularly happy to both see the faces and hear the voices of the staff that we have here that are able to relate directly and fluently to the communities that we serve. I can't say enough that we wouldn't be here today, we wouldn't be opening services like those at the professional building and this one without the steadfast support of President Preckwinkle. As I said at the opening of the professional building back in October, I've been a doctor practicing in the system for 20 years. I've seen plans and ideas and recommendations come forward about improving our facilities. A study that was done in 2012 suggested that our health system facilities alone were $180 million behind on investments and improvements and upkeeps. And it wasn't until the leadership of President Preckwinkle that we got moving and improving those facilities. So Tony, I'm very, very grateful. And I also, most of the time when I'm talking about other healthcare systems, I'm talking about them as our competition. But I want to take a moment to sincerely thank the people at the Northwest Community Hospital. Their ongoing support, not only for the first driving need historically to open this clinic and the origins of this clinic, but their support by giving us space at our old facility in Palatine, and then critically important, extending the time that we could stay in that space, and then helping us with another bridging facility when we had to leave that space in Palatine, but this one wasn't quite ready on time. And the leadership of Northwest Community Hospital was always there. They were always supportive and very patient with us. And I can't say enough, I'm very, very grateful for that, Mayor Hayes.